Back to another of our top stories. South Africa's COVID-19 vaccination drive could soon get a boost, as I was saying earlier, with the approval of the Sinovac vaccine. The South African Health Products Regulatory Authority announced its approval this morning. Now, to understand what this means for the country's vaccine rollout, we can speak to Professor Shabir Madhi, who's joining us by Skype, I believe. Prof, afternoon. Always good to speak to you. How big of a boost could this be for our vaccination drive?
So it certainly is an important development, but whether it makes an impact on what we're going to experience in the next few months really depends on what quantity of vaccine would become available from Sinovac. And I think the SAHPRA statement this morning actually indicated that it's approved for use up to 59 years of age, which obviously does put some sort of limitations on its use in South Africa. But I think any vaccine South Africa can get, which has been pre-qualified by the WHO and has undergone WHO review and is likely to impact at least against severe disease and death, is most welcome.
And you make a good point there, Prof, that it's one thing for the regulator to give approval for a country to administer a particular drug or vaccine, but the true test lies in whether the government will order those doses.
Yes, order the doses as well as when those doses arrive. So as an example, although we're rolling out the Pfizer vaccine at the moment, it's going to have a very nominal effect on the outbreak, the resurgence that's being experienced in Gauteng. So it's also not just about a quantity of vaccine, but when those vaccines become available. And ideally, we would want whatever vaccines do become available at least by September, so that if we do experience another resurgence towards the end of the year, that people that are targeted for vaccination have completed their vaccination.
And on the approval of vaccines, Prof, if you're still with us, I want to ask you for your position on the debate around whether we should still be going the way of domestic regulators approving the vaccines for use, or relying solely on WHO guidelines and their permission and what they are saying about a particular jab at whatever time.
Yes, so we certainly do require local regulatory approval because WHO does the recommendation at a high level. So we need to take our cue from WHO, but I think there's still a need for local regulatory approval. Ideally, that should be approval for the region. And as an example, South Africa needs to pool resources with other countries in the region so that we have a regional approval rather than just a country-specific approval. And this is not just to assist South Africa, but also to assist other neighboring countries where the skill set to do this sort of approvals is even less than what exists in South Africa.
And the Sinovac jab, I was looking, has a shelf life of up to 24 months. That's going to be crucial given that COVID-19, A, is not going anywhere anytime soon, and B, we're not vaccinating the population as quickly as we need to, especially to reach a so-called herd immunity.
Well, we're never ever going to get to herd immunity. So even with the Sinovac vaccine as an example, we don't expect it to confer more than 50% protection against mild COVID due to the Delta variant, and probably even less against the Delta variant. It performs extremely well against severe disease and hospitalization, but not against mild disease. And to be able to get to herd immunity, we require vaccines that are able to actually prevent mild disease as well as infections, which is unlikely to be the case with a Sinovac vaccine based on the current evidence.
And based on that, Prof, does the rollout of multiple kinds of vaccines within a population in a country or a region further complicate the science at all when you look at what can do what?
Well, I think the reality is that we're not spoiled for choice. So we need to take what vaccines we can, because the immediate goal of vaccination, like I said, is not about herd immunity. The immediate goal of vaccination is to ensure that individuals that are at risk of being hospitalized and dying of COVID-19 are protected. And even if you can get 80 to 90% of those individuals protected, which is about 15 to 17 million South Africans, we probably could get back to a relatively normal lifestyle despite the ongoing circulation of the virus. And many of the vaccines that have been approved by WHO or recommended by WHO certainly fall in that ballpark where it would have high levels of effectiveness against severe disease.
Given our already much criticized vaccine rollout based on age as well as, at this point, professional designation, should we get rid of those requirements and just inoculate whoever is willing to come forward and take a jab?
No, I think we need to lower our age target, but we still need to keep it focused on high-risk individuals. I don't think we can afford to have a rush of people coming to be vaccinated and compromise the ability of people that are at high risk of developing severe disease, not being vaccinated or needing to compete for vaccination. So right now, where we still got constraints when it comes to the number of vaccines, we certainly should lower the age group, probably wouldn't take it down to 40 years of age, but ideally ask people that have underlying medical conditions to come forward, and those that are otherwise healthy, they probably could wait at least for a few weeks or 2 to 3 months until we got better vaccine supply security.
And there's been a lot of talk, especially online among South Africans, and when you listen to the talk radio stations, Prof, people saying, you know, we need to get vaccinated as soon as possible. We're seeing people in Europe now enjoying football tournaments, some of them not wearing masks. But when you look at the numbers in Europe, the UK, for example, you're seeing an uptick in infections. Yes, deaths are still low because that is what the vaccines are ultimately able to reduce most. But key to that is the fact that being vaccinated doesn't necessarily mean we're going to go back to, let's say, 2019 ways of living.
Well, we can go back to 2019 ways of living. I think we need to become comfortable that the virus is not going to go anywhere. We're going to see the occasional uptick in viral activity. People are going to get infected. But the United Kingdom is a good example, is that even though there are increasing number of cases of the Delta variant, that is just mild disease. Severe disease is pretty much extremely low in the United Kingdom because they've been able to vaccinate the high-risk groups. And that's the reason why they can get back to a relatively normal lifestyle. Despite the virus being around, they know that they're not going to have overwhelming of the healthcare facilities and people are not going to be dying in large numbers due to COVID-19. And that is where we need to be, protecting our high-risk individuals, and then we can get back to a relatively normal lifestyle, even with ongoing resurgences, which over time will probably become less severe than what we're currently experiencing.
Professor Shabir Madhi, always good to speak to you, sir. Thank you.